Good afternoon, everyone. My name is Dan Stein. I'm from Stewards of Change, and I get to play Master of Ceremonies today. And with that opening, you can imagine that we're going to have some fun over the next couple of days. We have a nice space to work in, plenty of space. A lot of elbow room here. You'll notice Anthony in the corner here taking some graphics, recording our efforts both in words and in pictures. Notice Chris back here doing some videotaping. So the intention here, as Shell was saying, is to involve everybody in this conversation and think a lot about how we're going to move forward together. So I'm going to just spend a little bit of time now kind of giving an orientation to kind of how we got here, why we're here, and kind of what we're going to be doing over the next couple of days. And we're going to move into action rather rapidly after that. So we're going to start with some math here. And the important part about this is figuring out what the L is and what the C is here. And some of you have seen this before, so you're not allowed to answer. But I think we want to start with this core idea, given the complexity of the tasks we have ahead of us. This is a concept that we think about a lot. Who would venture to solve this equation, or to name it? Who would think some recommendations of what the L might actually mean here? Love is not one of the answers. What's that? Law? Life, law, okay. Good start. A little louder. Leadership, that's a good one. On the way, that could be, sorry? Learning. So learning is actually the right answer there. And the greater than equal to C is actually change. And so the basic premise here is that we live in a world that is changing as rapidly as we can imagine and faster at times. And that the only thing that we have to face that kind of change is our ability to learn, and to be able to learn at or greater than the speed of change around us. And I know each of you, whether or not you're at the state or at the county or at an association or from a law, are facing this challenge all the time with the changing environment that we live in. So the fundamentals of what we're going to be doing over the next couple of days is really a lot about learning. It's about teaching, it's about learning, it's about providing an opportunity to get into this material in some detail and to learn from ourselves and to be able to apply that as we go forward to address these challenges and opportunities that we face. Now, each of us comes to this question with a different learning style. Some of us like to learn by reading, some of us like to learn by listening, some like to learn by watching, talking, some like to learn by dancing or moving or kinesthetically. Some of us like to learn by doing, and some of us like to do by writing. All of these are different methods and modes of learning. And so what we've designed into this 3 days is to actually use many, if not all, of these modes of thinking, because I know the last thing you want to do is sit here for the next 3 days and listen to me drone on about why this stuff is important. So we're going to engage you in a lot of interactive action, and we encourage you to participate. And of course, we have to do some reflecting. What we like to do is we like to make thinking visual. There are some estimates visual learners make up half the population, and yet we oftentimes only focus on the written word. Partially the reason why we're capturing information with graphics is it's a great way to see your words, see your thinking, and then also to be able to communicate that as we go forward. One of the things that we did at the very start of this work was we created a collaboration site, and I think pretty much everybody here visited that site. And those of you who didn't, we know who you are, but we will not call you out in this particular moment. But the intention of that really is to get people involved. On that side is a lot of materials. I'm hoping you had a chance to read some of them, but there are actually some graphics up there from the last session we did about 1.5 years ago with the Administrative Office of the Courts, and we'll talk a little bit about that later. But I just want to start out by sort of addressing the different approaches here. Now, as I said, the symposium itself has been developed and designed to really be integrated, in the sense that the learning and the presentations and the interactive exercises we'll be doing are designed to actually build on one another. So what is important to think about is this is the first of two symposium that will be happening under this grant. And this one is really to get it started, right? This is about us hearing and creating the questions and the recommendations and the solutions and the ideas that will inform this plan that's going to be built over the next couple of months. And this is an opportunity for getting the thinking out, so we're able to capture that and work with it as we go forward. And then we'll be talking about what that going forward plan looks like and how we can engage all of you in that work as we go forward. And then we'll be out of here about 4:30 on Thursday. So there's a detailed description in your materials here, and we'll be following this, and we'll continue to come back to this and remind you of the agenda. Purpose here. One of the things that is really astounding here is this opportunity for massive change. I mean, we're talking about California and the leadership potential of not only within the state, but across the nation, really illustrating the possibility for change. And I very explicitly use the word massive because it's a giant state, and change is on a massive scale here. And it is important that we recognize how big that is. Another important purpose is to generate information to inform the interoperability plan. I just mentioned that. What are the questions, the recommendations, the solutions, the challenges that you see and you face from where you sit today? We want to co-create that future, right? So unlike many conferences or symposia you might be at, this is really about helping create what that plan will look like. So we want to build awareness and understanding and knowledge and capacity and investment, personal investment in this process, and motivation. We want to enroll and engage you and commit to the process, and we want you to build new relationships to support this change moving forward. And we've spent time and we're spending resources to be able to capture this information, to be able to synthesize it, so you, both for yourselves and to be able to take back into your programs or jurisdictions or organizations to be able to do that. And as you've seen, we've started already by, as I said, creating this collaboration site, which is a SharePoint-based site, but it allows us to start that. So when we leave this process, there's a format there for us to continue on. And then we're going to push ourselves into the new world of social media and see if we can actually have some meaningful conversations through a LinkedIn site that you probably have all gotten an invitation to. But we're going to try to create some new behaviors going forward to engage in these conversations. Now, I want to spend just a few minutes to see if, to share with you the approach that we're bringing to this symposium. So Stewards of Change, we've been around for 8-10 years or something like that. And we've been thinking about this question of information sharing and how do people share information, how do systems share information, and have had really the great fortune of being able to work in a number of jurisdictions, originally in counties, actually in the nonprofit sector originally, moved to New York City, and then did a bunch of work in counties in Pennsylvania and North Carolina and California and Maryland, and had the opportunity to really sort of be, I guess you would almost think about it as researchers in a way, but in a sense, looking at what was working on the ground. Archaeologists in that sense, of being able to look at systems that were actually approaching this work and studying them to see what they had in common. And so over the years, what we were able to do is study and look and then go look at some other systems and see what they were doing and be able to accumulate that information, bring people together across the country, and to share that learning with them. And so over the last 8 years, we've been bringing people together on a national basis to share that information, to refine it, to synthesize it, and then to put it back out into the nation. And what's evolved from that is this idea of a theory of change, which we call Human Services 2.0. And I want to share with you here some of the basic concepts, because those are embedded in the work that we're doing going forward. Part of that is to really start at the foundation with a consumer-centric or a client-centric perspective. So who is it that we're trying to serve? Is it a child in foster care? Is it a student? Is it a patient? Is it a family? Is it an adult? Is it a senior? All of you service different clients every day. And I think that all of you would say that your job ultimately, fundamentally, is to provide services, the right services at the right time, at the right dose to these individuals. Now that's easy to say, it's not so easy to accomplish. But we start from that basic premise. And we recognize that it's not a simple thing to do. So for those multi-systemic clients who might be touching the homeless system, the hospital system, the medical system, the nutritional system, they have a complex set of needs. And unfortunately, our social services and our health systems are designed to treat them individually and not collectively. This is a little like preaching to the choir, I know that, but when we see it starkly put up there, it does really reinforce, in my mind, the need to think about how we integrate across the service areas, because there are real people out there who need a variety of services, and to be able to accomplish that is not a simple task. Now, on a state level, the issues are as complex as what Shell showed in her diagram. This happens to be from Oregon, and I borrowed this from Rick Howard, who was the CIO up there. I thought it was a great diagram, and I can't do PowerPoint like that, so I figured I'd borrow his. But again, the key message point here is a lot of different systems, both at the federal and state and local level, delivering services, delivering funding, requesting information, and providing services. And there's a lot of duplication in those service areas that are circled by red. Everybody's asking for name, address, social security number, all those kinds of things over and over and over again. And this really illustrates the fact, both from an individual level, a group level, or a state level, the complexity of the issues we have to address. So I offer this because I want us to recognize that this is not a simple thing. If it was simple, we would have solved it by now. And the complexity is on a massive scale, whether or not you're Vermont or Wyoming, or if you're California or Illinois. It's important for us to recognize that. So the question is, can the silos be connected? So how many of you would say, yes, we're going to be able to do this? All right, Barbara, yes, okay. Any skeptics in the house? Maybe it's going to be hard. Okay, good. A couple of skeptics. Well, we should all be skeptical, because it's not an easy thing to do. And in fact, there's not too many places who have successfully actually accomplished this that well. But we think that interoperability can do that. A multisyllabic word that is interpreted and defined by people in very different ways. So I just want to spend a second and define it for us here, so we're all starting at the same place. It's the ability of diverse systems and organizations to work together. Originally, especially folks on the technology side, or who look at this, think or recognize this as a technical term originally, and it certainly was that. It certainly was the idea of how technologies or systems can interface or interoperate and share information. But in the general world, I think it's taken on a much broader understanding of not only the technical stuff, but the political, the social, the organizational components are being able to interoperate with one another. And that's the term that we use when we use interoperability, is how the systems can connect on a variety of factors. So I thought that the best example for interoperability that I can show in one slide is Travelocity or Expedia or one of those things. Has anybody not used one of these services? Okay, so this is interoperability in action. I can go on and ask for a flight from New York to California on a particular day at a particular time and get 5 answers, from 6 answers, whatever, from different airlines, different times of the day, different prices, all that kind of stuff. Now, none of these airlines have gone and redesigned their systems to have one system. The airline system hasn't done it. They have figured out a way to say, we'll take information from you and you and you and you in a way that allows us to represent it to the client, and that client can choose from that. Simple, right? Well, the basics of that are the basis of what we're talking about in what we're trying to do here. So some basic concept of how do we reuse information that's gathered once? How do we create a language that knows what if I'm talking about a patient or a client or a customer, we're talking about the same person. We're looking at the same kinds of information, whether or not it's price information or time information. Is it expressed month, day, year, day, month? All of those complexities have been accomplished through this in order to be able to get you a very simple answer on what it is that you're looking for. I think that's the simplest way of describing interoperability, especially to people who are new to the concept, if any of you are, in fact, new to the concept here. There's also another idea around continuity or a continuum of interoperability. We don't start interoperable, right? We don't wake up one day and say, okay, we're doing interoperability. It's a continuum. Many of us work separately or maybe next to somebody. We share some information occasionally. Maybe we actually cooperate on something that gets us a little farther ahead because we both haven't had to invest all of the resources. Maybe we actually get to collaboration where we're both contributing to something and we're reusing something multiple times. Or maybe we get all the way towards interoperability where we've agreed that we're going to bring together organizations, use one system, use one approach, and each of us will be able to leverage and take advantage of that. So I hope that that gives you a sense of where we're starting. I think if we went through every program area, and we've done this in the past, and sort of allowed you to sort of put yourself in somewhere along this continuum, my guess is that many of you would be in the co-action or cooperation phase, maybe a little bit in the collaboration phase. Anybody put themselves in the interoperability part of the continuum yet? San Diego, do we hear you yet there? Yeah, you're there? Okay, come on. Be proud about it. Moving in that direction. So it's a way to think about it, and I think that's important that we get on the same page together around this. Now, we've all heard the term no wrong door before. Well, I think that is a good concept for thinking about what we're trying to accomplish here. With the sophisticated technology, the resources that we bring to the table, I think that we are at a place from a vision perspective to be able to address the needs of any individual. We should be in the position to be able to address the needs of any individual as they come in, whether or not they come in through a child welfare door, a health door, a nutrition door, a mental health door. The concept is wherever they come in, we're able to configure our services to their specific individual needs. That's the vision, right? I mean, people are striving towards that goal of being able to accomplish that. Again, easier said than done. So the way we think about this work is in a conceptual framework, which we talk about in terms of a theory of change, right? So everybody comes to this room and to this symposium with a different perspective, whether or not you're a technologist or you're an attorney or you're a social worker or you're a researcher or whatever. So you come with a set of ideas, a language in your mind, an approach, a model. And what we're trying to do is set a baseline to say, look, all of those things are important. You can be Delta or American or United. It's fine. You can keep that. We just need to agree on some terms and some language and some definitions so we know how to talk to one another. So we're not talking next to each other or over or under each other. And the purpose of this, as I said, over the years has evolved from a lot of input from a lot of people, is a way to think about it. And what we've done is we've talked about what we're trying to do in terms of a policy, a structural, or a practice orientation. So let's just know what we're talking about when we start the conversation. We're talking about a policy conversation as opposed to a structural conversation about what kind of technology. Very different kind of conversation. We could be talking right past each other. We don't know that. So part of it is agreeing on some basic terms, what policy is, what structure is, what practice is, so that we start the conversation right. Are we talking about innovation? Are we talking about outcomes? Right? Those are very different things. Innovation requires some disruption, some change. Outcomes is about driving very linearly towards an outcome. And are we talking about a rapid change, which many of you who are involved with health benefits exchange are dealing with I would call a revolutionary change at this point in time, or evolutionary change. And sometimes we don't have a choice. Right now, I think many of us are involved in an unexpected, or maybe we would like a little more time to do some of these changes. But I think it helps us to define what the problem is, what area we're talking about, what's the rate of change we're trying to accomplish, and how disruptive is that change as we go forward. So it's a high-level way of thinking about it. And so I want to drive down, just got a few more slides here, I just want to drive down here a little bit. So when we talk about Human Services 2.0, it's really sort of the intention is to say, we've been at 1.0, right? And we know it's not the best place in the world to be. So how do we move to the next phase? How do we move ourselves forward? What's the to-be vision? What do we want to see the world become so that we can define that and work towards that goal? And so it's an approach that says we want to be consumer-centric, family-focused, community-based, technology-oriented. And what we've put into here is the ideas of policy, structure, and practice, and a language. A language that allows us to describe the complexity in a way that, that makes it understandable. And what we found, as I was describing the work we were able to do in multiple counties over the years, is to work with leaders who have been on this journey for a long time. And what we discovered was something in common, is that the leadership in those organizations were able to recognize and to understand that their role as a leader was to be able to pay attention to a lot of different complex pieces. If they were solely focused on any one of these drivers and not paying attention to the others, they were not successful. Or put the other way, for those leaders who we met with and those systems we worked with, that were able to understand the complexity of governance issues, of workforce issues, of building an open and inclusive system that there can be open and inclusive communication, not only with their staff, but with the community that they're working in. Interoperable information technology, how is that going to look? Performance management, funding, consumer-centric focus. Are we really focused on the consumer? Do we really listen to them? Do we really find out what they're thinking and wanting and what kind of job we're doing? The issue of public and political will, very important in terms of being able to have our systems and our solutions adopted. Confidentiality, and of course, bridging service silos. Each of these are an area of study. Each of these are a whole body of knowledge that goes into each of these things. And that we need to understand where we're at when we're undertaking this kind of change at the level that we're talking about. It would be like building a skyscraper without doing a thorough engineering analysis. What's the ground made up of? What's the kind of rock? Where's the wind blowing from? Where are the faults in the ground? In somewhat the same way, we want to know as much as we can about the organization's capacity, competency around these drivers, so that we can know going into this complex, multidimensional world what it is that we're approaching in terms of change. And so we're going to be talking about some of these drivers over the next couple of days, and you're going to have the opportunity very shortly to actually dive into this stuff. But what we've done is we've also taken these kind of dry topics and we've turned them into pictures, because we know that people are visual learners, as I've said, and that as a way to communicate these ideas through iconography and through visual reminders, we've created these icons that we use that helps very quickly to share information with people. It also makes it a little fun. Now, as if interoperability wasn't a tongue twister, we went ahead and created this other word, which is called interoptimability, which is how do you integrate and optimize? How do you take this work, put it together, and then create a process? And this really is a process that we've done now numerous times, starting at the county level, at the state level, and most recently at the federal level at the Administration for Children and Families, where we've completed a number of steps along this process. And again, the purpose of this is the purpose of this is to say we don't need to recreate the process. Many people have been through the process. We can start with the process with the language in mind and move forward rapidly, as opposed to spending a year or two redesigning a process of how we want to get there. We can build on a lot of experience that's been out there before. A lot of this stuff is documented. I'm not going to go into the detail of it, but this is kind of underlying a lot of what it is that we're going to be talking about over the next couple of days. So that when you leave here, you should have a sense of it, and we should have a sense of how we're going to move forward. And as we think about moving forward, have a common language that allows us to communicate with one another. So what this is a national vision landscape, which is about 20 feet long when it was actually completed. And we did this about 5 years ago at a national event to begin to outline what a national vision for human services might look like. And I show that to you because I want to let you know, first of all, kind of what we're headed towards, from a visual perspective, but also that there's been a lot of thinking about what a future state might look like that we can build on as we go forward. But I want to come forward and kind of talk about how we're going to move forward here. So this is a process, and we've designed it to be an inclusive process, and we ask you to engage in this. We ask you to ask questions, clarifying questions, and audacious questions to not only me, but the speakers and the presenters up here, and to find out what you don't know. Because if you don't understand, I can guarantee someone else sitting next to you may not understand as well. So think about what you're hearing, what you're understanding, and raise the question. And as Shell has said before, we are the change. It's incumbent upon us, the opportunity has been given to us to really embrace and to really set a vision for the state as we move forward. It's an incredible opportunity, and it's a bit of a daunting opportunity to think about the opportunity to really design where this is going over the next few years.